Can I ask you to please state your name and birthday?
Victoria Edding, 6294.
And where are you at right now, Victoria?
I'm at the hospital.
And what is today's date?
May 10th, 2016.
I'm going to ask you a question to assess your judgment. If you were walking down the sidewalk and you found a wallet, what would you do with it?
I'd return it to the owner.
Patient is alert and oriented times 3. Speech is clear. Judgment and reasoning is intact within normal limits. General appearance, patient body structure is symmetrical, no abnormalities noted. Mood, affect, and clothing are all appropriate for the situation. Now, Tori, we're going to start the examination at your head, and we're just going to move in a systematic fashion from your head down to your toes. So looking at the patient's head, we're looking at its shape. It is normal cephalic. Facial features are symmetric. I'm going to feel the top of your head. No masses, lesions, or tenderness noted. Hair is evenly distributed. Now we're going to move to your eyes. Looking at the patient's external structures, eyelids are present, intact, no lesions noted. Eyelashes are present, evenly distributed. Can you open your eyes for me? Scleras are white. Conjunctiva is pink and moist. Now we're going to assess the visual acuity of your eye. So can you see the Snellen chart on the wall? I want you to read the smallest line possible with both of your eyes.
LMNOP.
Now can you cover your right eye and read with your left eye?
LMNOP.
Now can you cover your left eye and do it with your right eye?
LMNOP.
Patient's vision is 20/20 bilaterally. Now we're going to take a look at your pupils. So I'm going to shine this light into your pupils and see how they react to light. Now I want you to focus on my pen, and can you see the monitor on the wall? Now look at my pen, now the monitor. Patient's pupils are equally round and reactive to light. Accommodation is noted. Direct and consensual response is noted as well. Pupils are approximately 3 millimeters in size. The next test we'll do, Tori, is to assess the movement of your eye. So I want you to follow my pen light in the 6 cardinal gazes of direction, keeping your head still, okay? Cranial nerves 3, 4, and 6 are intact. The next test that we will do is called the cover-uncover test. It's going to assess the coordination of your eye muscles and seeing if they work together. So I'm going to cover your right eye, and I want you to keep a fixed gaze at my nose. Gaze is fixed and steady, no nystagmus noted. All right, now I want you to cover your right eye, and we're going to assess your peripheral fields through confrontation, okay? So I want you to identify what number I put in your left upper field, okay?
2.
All right, now with your right eye still covered, your right lower field.
2.
Now can you cover your left eye, and we'll repeat those.
3.
And in the bottom left field,
4.
patient's peripheral fields are intact. Now I'm going to take my ophthalmoscope, and I'm going to shine the light and see how your retina reflects the light. Red reflex is noted bilaterally. Cranial nerve 2 is intact as well. Now, Tori, we're going to take a look at your nose. Skin on nose is intact, warm and dry to the touch. It is symmetric in shape. We're going to take a look at the inside of your nose. Nasal mucosa is pink, moist, and intact. Septum is non-deviated, and turbinates appear within normal limits. Now Tori, we're going to assess your first cranial nerve, which is your olfactory nerve. It's your ability to identify senses of smell accurately. So I want you to close your eyes and cover your left nostril. Then I want you to try to identify the substance.
Vanilla.
Right, now we will repeat that test with your left nostril.
Lemon.
Nares are patent bilaterally, cranial nerve 1 intact. Now I'm going to palpate your sinuses, and I want you to let me know if you feel any tenderness. No tenderness noted in the frontal or maxillary sinuses bilaterally. Next, we're going to take a look at your ears. So looking at the outside of the ears, the skin is warm, dry, and intact. Palpating the pinnae, mastoid, and tragus. No masses, lesions, or tenderness noted. So we're going to take a look at the inside of your ear canal. External ear canal is clear, no inflammation, no foreign bodies present. Tympanic membrane is flat, gray, translucent, no scarring. Tail of malleus noted. Cone of reflection noted at 7 o'clock. Left external ear canal is clear, no inflammation, foreign bodies present. Tympanic membrane is flat, gray, translucent, no scarring. Tail of malleus noted. Cone of reflection is noted as well at 5 o'clock. Next, we're going to assess your ability to hear. So I'm going to stand on the side of you. I want you to cover your left ear, and I'm going to whisper a phrase. I want you to repeat that phrase back to me.
It's warm outside.
Okay. Now I'll repeat that and cover your right ear.
Happy birthday.
Cranial nerve 8 is intact. Next, we're going to assess your ear's ability to conduct vibration. So this is what's called the Weber test. So I'm going to strike the tuning fork and place it in the middle of your head. I want you to let me know if you hear the vibrations equally in both ears.
I hear it equally in both ears.
Cranial nerve 8 is intact, no lateralization present. Next thing we're going to do is the Rhine test. So it's your ear's ability to conduct sounds through your bone versus air. So what I'll do is I'll strike the tuning fork, I'll place it behind your ear, and I want you to let me know, say now when you stop hearing it, and then I'll put it in front of your ear, and I want you to say now when you stop hearing it in front of your ear.
Now. Now.
Okay, we'll repeat that on your left ear.
Now. Now.
Cranial nerve 8 is intact. AC to BC conduction is 2 to 1. Now it's where we're going to take a look at your mouth. So inspecting the patient's lips, they're pink and moist, symmetric. Can you open your mouth for me? Teeth are present, no decaying or caries present. Oral mucosa is pink, moist, and intact. Hard palate appears ridged, soft palate soft. Tonsils non-swollen. Can you say ah? Uvula rises midline. Now can you stick your tongue out? Now move it side to side. Now Tori, I'm going to take this tongue depressor. I'm going to press it against your tongue. I want you to try to lift it. Right. Now I'm going to stick it to the back of your throat to elicit your gag reflex. Gag reflex is present. Cranial nerves 9, 10, and 12 are intact. Tongue also protrudes with symmetric movement, and muscle strength is 5 of 5. Now it's where we're going to take a look at your face and the movements of the muscles in your face. So can you smile? Show me your teeth. Now frown. Puff out your cheeks. Raise your eyebrows. I want you to close your eyes, and I'm going to try to hold. I want you to try to open them while I hold them shut. Okay. Cranial nerve 7 is intact, muscle strength 5 of 5. Now I'm going to palpate your temporomandibular joints. No warmness, crepitus, or tenderness noted. Can you move your mouth up and down? Jaw movement is symmetric and smooth. Can you clench your mouth shut? Muscle strength 5 of 5. Now I want you to try to keep your mouth shut. Okay. Next thing we're going to do is assess the sensation in your face. So the rounded end of the tongue depressor is dull, the broken edge is sharp, so I want you to differentiate between each sensation, okay? Can you close your eyes for me?
Dull. Dull. Sharp. Sharp. Dull.
Cranial nerve 7 and 5 intact. Now we're going to take a look at your neck. Patient's skin is warm, dry, and intact. Trachea is midline, no deviation. Carotid arteries are +2 and equal bilaterally. Now I'm going to listen to your carotid arteries for any turbulent blood flow. Can you take it and hold your breath? All right. One more time. No bruits noted in the carotid arteries bilaterally. All right, Tori, now I'm going to get behind you and I'm going to palpate your thyroid. No masses, tenderness noted. Now can you swallow? Thyroid rises and falls midline with swallowing motion. All right, Tori, now I'm going to assess the range of motion of your neck. So can you look up and then down and side to side? Okay, now I'm going to hold my hand against your face. I want you to try to turn your head. Okay? All right, now shrug your shoulders. Cranial nerve 11 is intact, full range of motion in the cervical spine, muscle strength 5 of 5. Now we're going to move down to your front of your chest. So inspecting the shape, it is symmetric. There's no retractions or bulges noted. Skin is intact, warm and dry to the touch. No masses or tenderness noted. Now I'm going to listen to your breath sounds in 8 different points so we can hear the entire fields of each one. So I want you to take a deep breath in and out. Patient's respiratory rate and rhythm are within normal limits. They are regular, even, and non-labored. Breath sounds are clear and equal bilaterally. Next thing we're going to do, Tori, is I'll have you lie down on your back and we're going to inspect the skin over your heart, which is called your precordium. Okay, so looking at the precordium, there's no pulsations, heaves, or thrills noted. PMI is +2 in grade. Now I'm going to listen to each one of your valves, okay? I'm going to listen with the diaphragm and the bell of my stethoscope. So I'll listen to the aortic valve, which is at your second right intercostal space, sternal border. Then your pulmonic valve, which is at your second left intercostal space, sternal border. Then Erb's point, which is the third left intercostal space, sternal border. And then we'll listen to the tricuspid valve, which is the fourth left intercostal space, sternal border. And then we'll listen to the mitral valve, which is the fifth left intercostal space, mid-clavicular line. We're going to listen to the apical pulse for 60 seconds. heart rate is 73 beats per minute. S1 and S2 is noted. No murmurs or gallops heard. All right, Tori, now I'm going to have you sit up on the side of the bed again. We're going to take a look at the back portion of your upper body. Looking at the patient's anterior to posterior diameter, it is 1 to 2. Palpating the patient's skin, it is pink, warm, and dry to the touch. No masses or lesions noted. Feeling the spinous process, it is midline. No masses or tenderness noted. Okay. Now I'm going to put my hands on your back, Tori, and I want you to take a deep breath in and out. Lung expansion is equal and symmetric bilaterally. I want you to let me know if you feel any tenderness, okay? No costovertebral tenderness is noted. Now, Tori, I'm going to percuss over each area of your lungs to see if there's any undesired sounds heard. Tympany and dullness heard, respectively, in the appropriate locations. Now I'm going to listen to your breath sounds on the posterior portion of your chest. So I want you to take a deep breath in through your mouth, in and out. Posterior breath sounds are clear and equal bilaterally. No adventitious breath sounds noted. All right, Tori, now we're going to assess the range of motion of your spine. So if you could stand up for me. All right, now I want you to bend over at the waist and hold your arms, let them hang freely. You're going to just feel your spine. Cervical spine, thoracic spine, and lumbar spine, all normal curvature. No scoliosis noted, no gross deformities noted. Okay? Now can you bend back and then turn side to side? The patient has full range of motion in her spine. Now Tori, we're going to take a look at your abdomen. So if I could ask you to sit down again for me and lie back. And with your knees slightly flexed, we'll take a look at your abdomen. Patient's skin appears to be intact. Patient's abdomen is flat. I'm going to listen to your bowel sounds. All right, now I'm going to listen to your abdominal arteries for any turbulent blood flow, okay? We'll start with your abdominal aorta, your left renal artery, your right renal artery, your right femoral artery, and your left femoral artery. No bruits noted in the abdominal aorta, the left or right renal arteries, or the left or right femoral arteries. All right, now I'm just going to lightly palpate your abdomen. I want you to let me know if there's any tenderness. No tenderness is noted. We're going to palpate your right and femoral arteries. Femoral arteries are +2 and equal bilaterally. Now I'm going to do the right costal margin of the lower left liver is palpated and in the appropriate location. No rebound tenderness noted. No aortic pulsations noted. Now I'm going to deeply palpate to see if there's any masses in your stomach. No masses noted. And bowel sounds are normal, active, in all 4 quadrants. All right, Tori, now we're going to take a look at your upper extremities. So if I can get you to sit on the side of the bed for me again. All right, can you stick your arms out in front of you for me? Patient's arms are equal in length. Skin is intact, warm, and dry. Muscle tone is normal. Can you squeeze my hands? Good squeeze. All right, grip strength is present. I'm going to palpate your brachial pulses. Brachial pulses +2 equal bilaterally. Radial pulses +2 and equal bilaterally. I'm going to check your capillary refill time. Can you see your other hand? Nail beds are pink. Capillary refill is brisk, less than 3 seconds. Angle of nail is approximately 160 degrees. Now I'm going to palpate each one of your joints. No warmth, tenderness, or crepitus noted in the shoulders, elbows, or wrists. Now, Tori, I want you to hold your arms out in front of me, or in front of you, and I'm going to try to push, okay? Don't let me push. All right, now I'm going to pull, don't let me pull. Muscle strength is 5 of 5 in the upper extremities. Now we're going to assess the range of motion of your upper extremities. So, can you take your right arm and go over your shoulder and behind your back? Now, under your shoulder and behind your back, and then across to your shoulder. And can you repeat that with your left arm? Now, can you hold your hands out in front of you and move them up and down, and then side to side? Patient has full range of motion in her shoulders, elbows, and wrists. Now, the next thing we're going to do is assess your body's ability to know whether the joint is in the correct position or not. It's what's known as your proprioception. So what I'm going to do is take your right hand and I'm going to stabilize the middle of your finger. I want you to close your eyes and tell me if it's up or down, okay?
Up.
We'll do that with your other hand.
Down.
Patient's proprioception is intact. Next thing we'll do is assess the sensory ability in your upper extremities. So, like your face, you'll differentiate between a sharp and dull sensation.
Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. Sharp.
Patient's sensory is intact bilaterally in her upper extremities. Next thing we're going to do is assess the vibratory sensation in your distal extremities. So I'm going to strike the tuning fork and I want you to let me know if you can feel the vibration.
I can feel that. I can feel that.
Vibratory sensation is intact. Now to where we're going to assess your cerebellar function and your fine motor coordination of your upper extremities. So can you take your right hand and with your index finger touch your nose? Now with your left arm. Okay. Now can you pat your hands in rapid succession? Okay. Patient's fine motor coordination in the upper extremities is intact bilaterally. And the last thing we'll do with your arms is assess your deep tendon reflexes. So we'll assess your right tricep and your right brachial and your right brachioradialis. And we'll do that in your left arm. So your left tricep, your brachial, and your brachioradialis. Patient's tricep, brachial, and brachioradialis deep tendon reflexes are present and intact bilaterally. Next thing we're going to do is assess what's called stereogenesis. So what I'll have you do is hold out your palms, and I'm going to trace either a letter or a number, and I want you to correctly identify that.
7. Oh.
Graphesthesia is intact, or stereogenesis, I'm sorry, is intact. And the next thing we're going to do is test your graphesthesia, which is to your body's ability to correctly identify shapes and objects. So I'm going to place an object, and I have a coin, a paper clip, and a key, and I want you to close your eyes and accurately identify which object I'm putting in your hand.
It's the coin. Key. Paperclip.
Okay, can I see your left hand?
Key. Coin. Paperclip.
Graphesthesia is intact bilaterally in the upper extremities. That's where we're going to take a look at your lower legs. Or first, I'm going to take a look at your shoulder. Shoulder alignment is equal and symmetric. I'm going to take a look at your hips. Iliac crests are even, and hip alignment. Hips are aligned and symmetric. We're going to feel your skin and your muscle tone. Skin is warm and intact. No tenderness, masses, or lesions noted. No varicosities or edema noted. Posterior tibial pulses +2 and equal bilaterally. Dorsalis pedis pulses equal +2 equal and bilateral. +2 and equal bilaterally. And check your capillary refill like we did on your fingernails. Nail beds are pink. Capillary refill is brisk in less than 3 seconds. There was no warmth, tenderness, or crepitus in her hips, knees, or ankles. Now we're going to assess your range of motion. So can you lift your right knee and your left knee and kick your legs out? Now can you move your ankles in a circle and back and forth? Patient has full range of motion in her hips, knees, and ankles. Now we're going to assess the muscle strength in your lower extremities. So I want you to try to raise my hands with both your knees. Okay? Now I want you to try to pull against my arms. Now kick against them. Now push my hands like a gas pedal. Patient has muscle strength 5 of 5 in her lower extremities. And now we're going to do your sensory in your lower extremities like we did your arms. So I want you to differentiate between a sharp and dull sensation like you did before. Okay?
Dull. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull.
Patient's sensory is intact and bilaterally in her lower extremities. Now, Tori, what we're going to do is assess your vibratory sensation like we did in your upper extremity. So I want you to let me know if you can feel the vibration.
I can feel that.
Okay?
I can feel that.
Alrighty. Now we're going to assess your deep tendon reflexes just like we did in your upper extremities. So we'll do your patellar. Patellar deep tendon reflex are present in bilaterally in lower extremities. And then we'll do your Achilles. Achilles deep tendon reflex is present bilaterally. Now, Tori, what we're going to do is assess what's called the Babinski reflex. So I'm going to trace from the lateral aspect towards your big toe, and we'll see if your toes move in a certain way. Babinski reflex is absent bilaterally. All right, Tori, I forgot to palpate your lymph nodes, so I'm going to palpate those to see if there's any swelling or tenderness. So we'll start on the back of your head with your occipital lymph nodes, your preauricular, or postauricular, preauricular, your tonsillar, your submandibular, your submental, your superficial cervical, your deep cervical, your supraclavicular. Can you lift your arms? Your deep, your pectoral, your lateral, your subscapular, and your infraclavicular. No tenderness or swelling is noted. All right, lastly, we're going to stand and we're going to assess your balance and coordination. So if you could stand for me, I want you to walk to the end of the room, and then when you walk back, I want you to walk heel to toe. Patient is mobile, gait is steady and coordinated. All right, now can you stand on one foot? Now with the other leg. Patient's fine motor coordination is intact in the lower extremities. Next, we're going to assess your balance with what's called the Romberg test to assess if there's any excessive swaying, okay? Okay. Romberg test is negative, no excessive swaying is noted. All right, Tori, that is all I have for today. I just want to thank you for your time.